speaker for today is going to be David Namara, Director of Logistics from Cleveland Clinic, Abu Dhabi. And today he's going to be talking on a subject entitled The Impact of Our Aging Population on Healthcare Procurement. Now, David has worked in the medical procurement for the past 20 years in Ireland for the Irish Health Service. But for the past 3 years, he's been based here working in the Middle East. Ladies and gentlemen, please welcome to the stage David McNamara, Director of Logistics, Cleveland Clinic, Abu Dhabi.
Good morning, and thank you to Blue Ocean Academy for inviting me here today. It's a real honour to stand in front of you guys, and thank you to John also for the invitation. My talk this morning is going to be very, very brief, and it's a talk that I hope people will go away and start thinking about what the future holds for each and every one of us here because of our aging population. Just to give you some context, in Europe and all of our developing countries, we have a massive, massive explosion of elderly people. Now that might sound really unfair to the elderly people, but what happened in the 1940s, late 1940s, late 1960s, there was a baby boom. These people now are coming into their late 60s and 70s. This huge increase of elderly population is going to put enormous pressure on health services. It's going to put enormous pressure on governments to fund health services. So as procurement specialists, you guys outside here have got to think outside the box and find how you can become efficient, effective and economic with your money. Because it's up to you to find the best prices, the shortest supply chain and the best supply chain to take care of this elderly population. Health trends are going to be mixed. So what we'll have is our severe disabilities will decline, and they're declining because technology is moving so quickly in healthcare that we can reduce these severe disabilities. But what we've got to worry about is obesity, diabetes, issues got to do with cardiopulmonary disease, and so on. So as supply chain experts, you need to move into a new field, into a new supply chain, and start building supply chain to take care of these diseases that are going to come and hit us in the near future. So what then happens is the amount of people who are going to be working is going to reduce. So that means income into families is going to reduce tremendously. The spend we have through taxation is going to reduce. So the amount of hospitals that we need are not going to be there. So therefore we need to find a supply chain that we can take care of our patients at home in their own homes. So all healthcare will not happen in hospitals, so we have to find a way of delivering the goods to the patient in their own homes. There is a huge possibility for maybe one of you out there to start a supply chain that look at home care rather than hospital care. When you can imagine that in each family there will be one person who will at some stage need healthcare attention, they're going to need supplies and they're going to need large volumes of supplies. So expenditure in the long term is going to increase. The older you get, the more you spend on your healthcare. It's like when a baby is born, the first few months of their care is going to be taken care of by a doctor, and in the last few years of your life, your healthcare expenditure is going to rise because you attend your doctor more often and you attend the hospital more often. But the money is not going to be there to support the large population of elderly people. So the only way hospitals can save money to treat the elderly population is to reduce their costs. Reducing their costs can come from procurement and supply chain. That will be your job, to become more efficient and more effective. Okay, sorry. So we'll just take some figures, the facts, and this is just European facts, but they're going to be mirrored here. It's going to happen quite soon. So in 2016, EU countries spent 14.2% of GDP on healthcare. And if you look at where it came from in 1988, it was only 7.3%. As the population grows older, that GDP spend will have to rise, and it will rise extremely quickly. So the governments are going to have to find ways of saving money. And again, I'll go back and repeat it. The way the hospitals can save money is through supply chain and through strategic procurement. And as you said, Abu Dhabi, the Middle East is becoming the hub for logistics. Most of the products that we will procure will come from the Far East, they'll come to the Middle East, and they'll be dispersed worldwide. That is where you're going to play a key part also. Okay. There will also be an increased demand for geriatric care and step-down facilities. Here within the Middle East, we don't have step-down facilities. We don't have care homes for old people. That's another opportunity, and it's another opportunity where you have got to supply your goods and services to the market. It's a new market for taking care of older people in either their home or a step-down facility. And we've got to start thinking now, how are we going to do this? How are we going to support these old people? How are we going to support this new market? Lastly, on this slide, because we don't have enough hospital beds here, home care is going to be very, very, very important. So again, for anyone who's in the medical care, an older person demands healthcare 24 hours a day. They demand a range of products that are not available here readily. So again, as the population of old people grow, ye have to step up to the mark and ensure that we have a supply chain directly to their homes. So this is our challenge, and this is true of the Middle East, the same as any other country in the world. In 2005, there were 25 people aged 65 plus for every 100 people of working age. But if we look in 2050, there will be 51 people over 65 for every 100 people. That is a 100% increase. As we push out in years, now 2050 is not too far away. This is 2016 now, it's a very, very short space of time. Those people over 65 will increase and increase and increase. We have got to make sure we can provide a supply chain for these people. The products that they will require will be totally different than what they need today. It'll be a total mind shift, a total change. Supplies have got to be there. So this is from the European perspective. 80% of healthcare is funded by taxation. I don't know what the figure here, but it is quite high in the Middle East. So how are we going to support healthcare in the future as the needs increase? Again, I'll go back to say it, the only way we're going to save money is through procurement and strategic buying and logistics. Shorten the supply chain, make better deals, cut better prices. So we're going to have some challenges, and this has all got to do with technology. I remember I had my appendix out around 20 years ago, and I spent 4 days in hospital. You can get your appendix out now in the morning, and you can be playing golf in the afternoon. That's how fast technology will move. So what's going to happen to us in the future, we're going to have to deal with stem cell research, cancer, heart disease. So could you imagine today we're importing beds, dressings, wheelchairs. In a couple of years, we will be importing and delivering stem cells. It's another change that we have to face. So our logistics system and our transport system will have to change also. So the biggest problem, or one of the problems we have with technology, is we prolong life. We can keep people alive almost as long as you want now. We can put them on ventilators, heart machines, give them lots and lots of drugs, but the problem we have is, what's the quality of life? So you can have a 90-year-old person, technically who's alive, but can't eat, drink, speak, move, unless they're aided by somebody. So most of this is going to happen at home because we don't have the step-down facilities and we don't have the geriatric care to look after these people. So again, back again. We have to be able to supply a health service at their front door to provide the goods and services that they need at a reasonable price. Okay? So even for storage and delivery systems, anything that we're buying today, in 20 years' time, we probably will not buy. We'll have a lot of cold chain supplies. We'll have a lot of big equipment that's needed for home care. So we need to think about our supply chain and our storage system there. The expertise will change. I see a couple of guys from my own warehouse division here. Very smart people, some of them with PhDs. in a couple of years' time, when you are hiring your staff, is trying to get the caliber of people you need is going to be your biggest issue. You will be looking for scientists, you will be looking for PhD people, people who can work in your logistics system, not to just lift boxes and move them from point A to point B, but to look at samples, to look at DNA, to look at, I've seen corneas being delivered quite lately into the UAE. That's going to increase. So the skills that our people have, we have to work on them. We have to build them, like with Blue Ocean, to a certain standard that will be acceptable. So the basic requirements will increase to fit our aging population needs. So if you look now at your staff and you say, what do I need in 20 years' time? Your question is, do I need PhDs? Do I need scientists? I need more than someone who can lift a box. Now is the time to start training your staff and make sure they're available when you need them. So how do we prepare? Obviously, we got a plan. A strategic plan goes out maybe 5-10 years. But we've got to start now because the population in the GCC, in the Middle East, is going to increase, the older population, and we've got to be prepared for it. Now is the time to start planning. Invest in education and develop your teams. Blue Ocean are doing it now. So more companies need to push their people to academies like Blue Ocean and get them prepared, even if it's just the basics, and build on the basics as they move out. Use technology. Even if you go outside this door here, the amount of technology that's available now is enormous. The amount of technology we'll need in the future is going to be far bigger. People will have to be able to order their goods and services from their own bed, from their home. Even down to ordering a clinician, a doctor or a nurse to come to your house to change a dressing, to fix a bed. So if we look at our local demographics, currently in the UAE, we got to say to ourselves, what's this going to be like in 10 or 15 years' time? What will I need to do now? How do I build my business now? You look at the population, it looks pretty young. They're all mid-ages, about 45. 20 years, obviously, doing good maths, 65 years of age. Their demand is going to change. Move out 20 more years, the demand is going to change even further. So strategic planning and demographic planning is very, very important. So the basics, if we stand still as procurement and supply chain experts, we're going to be left behind. We have to start planning for the future with a very high population of elderly people. Okay, so that's a very short overview of what I wanted to say. You could spend hours and hours talking about this, but if any of you have any questions, now is the time to ask.
Ladies and gentlemen, this is Mansoor from logimart.com. I'm CEO of the company, Online Logistics Marketplace. I just would like to know what's the impact of digital printing, 3D printing in the same domain you are talking about.
Well, that's the technology, and 3D printing is in its infancy, but I can guarantee you in 10, 15 years' time, we will be making heart valves, we'll be probably making limbs out of 3D printing. Technology moves so quickly, and I know factually that people are actually looking at that now. So it will happen, and we have to be prepared for products like 3D printing. How do we get it from, say, the United States to here? And how do we develop that supply chain? That is going to be key.
David, my question to you is this. If you were to give people advice on the 3 immediate steps to take right now for this change in logistical strategy, what would they be? The first 3 for change today.
The first one is you need to look at your demographics. Where are we now, and where do we want to be in 20 years' time? What are my new customers going to be like? Then look at your technology. What's available in the market now, and how much do I have to invest for the next 20, 30, 40 years? And 3, the most important one is, where am I going to get the skilled people to do what I need to do? And it's here in academies like Blue Ocean that we start building those people. Thank you.